It's quite a culture shock.
There are residual effects of the stress, the burnout from, COVID.
Good evening. 5 years ago, COVID officially came to Springfield. The diagnosis made at a Cox Health clinic, then a state of emergency for Missouri the next day.
Reagan DeTrolio is live near Mercy Hospital to break down what it was like for doctors and nurses working to save lives through the pandemic. Reagan?
Steve and Lisa, healthcare professionals here at Mercy and at Cox Health say navigating the pandemic was scary. It also taught them lessons that they still apply to their work today.
It was just so much unknown. When the COVID-19 pandemic struck, everyone, especially in the medical field, had to adapt.
Drastic changes were made to the emergency care landscape during that time out of necessity to try to care for all these people that were so sick.
The Springfield Greene County Health Department was in uncharted waters. Current health director Katie Towns says her staff learned a lot from the pandemic, but she says there's still much to improve on.
There are lots of things with regards to communication and information flow that we are working with our state partners, and I know our state partners work with our federal level partners to try and help that information flow more seamlessly between the different agencies.
Those who worked tirelessly treating the thousands of patients say the pandemic put hospital staff through the ringer.
We lost many great nurses and great caregivers, chose to leave the healthcare field altogether during that time. It was so difficult. But a lot of burnout. We leaned on each other pretty hard during those times.
In some cases, people worked, weeks and months without days off, in full protective equipment from head to toe in our COVID unit. And that takes not only a physical toll on you, but an emotional toll on you.
And although none of us want to relive the pandemic, healthcare professionals say it prepared them for anything.
I wouldn't take it back necessarily. I think it has taught us so much, and if we are able to take the lessons and move forward and apply those things, we can all be better off.
Healthcare professionals say virtual care has advanced dramatically. It's proven to become a very valuable asset when in-person appointments aren't available or doable. Live in Springfield, I'm Reagan DeTrolio, KY3 News.